the vitamin that protects your nerves and stops neuropathy. The relentless agony of burning feet at 3 in the morning, feeling as if they are quite literally engulfed in flames, prompting you to desperately cast aside covers in search of elusive relief, yet finding none, is an experience of profound discomfort and frustration. Perhaps your personal torment manifests differently, as a sensation akin to 1,000 invisible needles ceaselessly piercing your hands, a constant barrage of sharp, debilitating pain. When such distressing symptoms are brought to the attention of medical professionals, the common, often dismissive response, a polite smile, a reassuring pat on the shoulder, and those two infuriating words, "It's just age," can ignite a simmering rage, trivializing genuine suffering. However, a profoundly unsettling truth often lurks beneath this superficial diagnosis. This widespread medical consensus is not merely incomplete, but catastrophically misguided. The insidious deterioration and subsequent demise of your crucial nerve tissue frequently bears no intrinsic relation to the natural process of aging, but rather points to an insidious culprit, a fundamental physiological imbalance lying hidden in plain sight, astonishingly preventable and remarkably fixable. The revelation of this truth can indeed evoke a profound sense of fury, born from the realization that such vital knowledge was withheld, that no one issued a timely warning. What should truly engender a chilling apprehension is the disquieting possibility that the very medications meticulously consumed each morning, undertaken with the earnest intention of safeguarding one's health, might paradoxically be the instruments slowly, systematically eradicating your exquisitely intricate nervous system. Having had the distinct privilege of engaging with countless patients in my clinic, individuals who invariably arrive burdened by the deeply ingrained fallacy that their nerve pain is an immutable, permanent fixture of their existence, having resignedly accepted it as an inescapable new reality, I can unequivocally state that their belief is profoundly mistaken. Their suffering, far from being irreversible, is often a call for understanding and intervention, and I am resolutely committed to illuminating the path to proving precisely that. Within the astonishing complexity of your human body, an intricate network comprising an astonishing 45 miles of nerves currently functions, a staggering length of biological wiring sufficient to traverse the considerable distance from New York to Philadelphia. These omnipresent nerves are the very conduits through which you perceive the entirety of your world. The gentle, reassuring caress of a cherished partner, the warm, embracing hug of a grandchild, the firm, grounding earth beneath your feet with every step you take, and indeed, every subtle nuance of your sensory experience. Each individual nerve fiber, a marvel of biological engineering, is meticulously enveloped in a resilient, protective sheath known as myelin. One might conceptualize this myelin layer as analogous to the rubber insulation that meticulously encases and safeguards electrical wires, preventing short circuits and ensuring efficient signal transmission. When this indispensable coating begins its lamentable process of degradation and crumbling, the consequence is a catastrophic cascade of neurological dysfunction. Nerve signals, instead of propagating smoothly and accurately, begin to misfire erratically. Pain receptors become hypersensitive and go haywire, and your brain, instead of receiving coherent and precise information, is inundated with garbled, distorted messages that it desperately attempts to interpret, translating them into excruciating sensations of burning, sharp stabbing, or unsettling electric shock. Moreover, once this degenerative process commences, it tragically does not possess the inherent capacity to spontaneously arrest its own progression. This debilitating medical condition, a silent epidemic of modern times, bears the clinical designation of peripheral neuropathy. Presently, an alarming figure exceeding 20 million Americans find themselves grappling with the profound suffering inflicted by peripheral neuropathy, representing a staggering prevalence of approximately 1 in every 16 individuals in the population. It is, therefore, a virtual certainty that someone within your immediate family circle, or perhaps even you yourself, is currently contending with the insidious grasp of this debilitating disorder. However, what truly fuels my indignation and impels me to produce and disseminate this vital informational video is the astonishing, almost unforgivable, reality that the vast majority of individuals valiantly battling this nightmarish affliction remain utterly oblivious to the fundamental truth that a ubiquitous and remarkably straightforward vitamin deficiency is, with chilling efficiency, systematically dismantling their nervous system. The truly sinister aspect of this unfolding tragedy lies in the unsettling fact that the very medications meticulously prescribed by your trusted physician, the ones you dutifully place your faith in, the ones you consume with unwavering religious adherence driven by a profound desire to maintain optimal health, are, day in and day out, insidiously draining this absolutely life-saving nutrient from the very core of your being. Allow me to meticulously delineate the precise, insidious mechanics of this cleverly disguised physiological trap. The scenario unfolds with a visit to your physician, where routine blood tests reveal an elevated blood sugar level, a common precursor to metabolic disorders. In response, your doctor promptly issues a prescription for metformin, a drug that holds the undisputed distinction of being the most widely prescribed diabetes medication across the entire planet, with over 150 million individuals worldwide relying upon its therapeutic effects. Reposing implicit trust in your doctor's expertise, you diligently adhere to the prescribed regimen, consuming the medication faithfully. Yet, like a vast segment of the modern populace, you also contend with the discomfort of chronic heartburn, an almost ubiquitous byproduct of contemporary lifestyles and dietary habits. Consequently, you concurrently incorporate omeprazole, or another proton pump inhibitor, PPI, into your daily pharmacological repertoire. This dual medication intake is, in the context of modern healthcare, considered perfectly normal, a routine observed by millions upon millions of individuals globally. Herein, however, lies the cunningly concealed trap, a critical piece of information that is regrettably and almost universally neglected in patient education. No one adequately explains that metformin, through its inherent pharmacological action, actively impedes the absorption of vitamin B12 within the delicate environment of your intestines. Numerous scientific studies provide irrefutable evidence that between a significant 10% and an alarming 30% of long-term metformin users inevitably develop a clinically significant B12 deficiency, with some research suggesting this percentage may even be substantially higher in certain populations. Simultaneously, the proton pump inhibitors you rely upon for heartburn relief are relentlessly diminishing the crucial levels of stomach acid, an acidic environment that is absolutely indispensable for the efficient extraction of vitamin B12 from the complex matrix of the foods you consume. Thus, you unwittingly find yourself ensnared in a perfect storm, a physiological maelstrom wherein your body is subjected to a relentless nutritional assault from two distinct and synergistic directions simultaneously. But the plot thickens, descending into an even darker realm of physiological vulnerability. If you have crossed the threshold of 60 years of age, your stomach, as a natural consequence of the aging process itself, inherently produces a progressively diminished quantity of stomach acid, regardless of any medication intake. The relentless march of time has already insidiously weakened your intrinsic digestive defenses. Now, compound this natural age-related vulnerability with the adoption of a meticulously maintained plant-based diet, which, by its very nature, contains virtually zero biologically active vitamin B12, and your predicament transcends mere risk. You are, in essence, sleepwalking into a profound nutritional catastrophe, with your eyes metaphorically closed to the impending peril. Your entire physiological system, every single cell comprising your nervous system, is silently, desperately, unequivocally screaming for this absolutely vital vitamin. Yet, virtually every prevailing factor, characteristic of contemporary existence, the indispensable medications prescribed for health maintenance, the often restrictive dietary choices, and the unavoidable, progressive physiological alterations wrought by the aging process itself conspires to mercilessly block its essential absorption and utilization. And here lies the true nightmare, the chilling realization that frequently deprives me of restorative sleep. By the time the overt and unmistakable symptoms of B12 deficiency manifest and finally capture your attention, you may have already sustained damage that has crossed the perilous threshold of irreversibility. That seemingly innocuous tingling sensation that you have perhaps habitually dismissed or ignored as a minor annoyance is not in fact minor at all. It represents your body's highly sophisticated emergency broadcast system, an urgent physiological distress signal. It is your precious nerves under siege and facing imminent demise, desperately launching flares into the neurological ether, pleading for immediate intervention. The subtle numbness you might be experiencing in your extremities today could chillingly serve as the early, insidious harbinger of a permanent, life-altering disability that awaits you tomorrow. I have, with profound sadness and regret, personally witnessed patients tragically lose their fundamental ability to walk, their independence irrevocably stolen, their dignity grievously compromised, all because they procrastinated, waiting far too long to address a condition that was, from its very outset, entirely preventable and eminently treatable. So, what precisely is this heralded miracle nutrient, this indispensable biochemical key that possesses the profound capacity to potentially avert such devastating neurological outcomes and restore vitality? It is none other than vitamin B12, a molecule whose historical narrative is not merely interesting, but absolutely fascinating, a testament to scientific discovery and human resilience. To fully appreciate its significance, we must embark on a journey back in time to the 1920s, an era when medical practitioners found themselves gripped by terror in the face of a mysterious and utterly fatal disease they ominously termed pernicious anemia. Patients afflicted with this enigmatic malady would progressively succumb to an alarming pallor, an overwhelming and debilitating weakness, and most horrifyingly, develop a constellation of rapidly progressive and grotesque neurological symptoms that invariably led to a grim and inescapable conclusion. It was always, without a single known exception, fatal. The medical community was utterly powerless against its relentless progression. Then, through a stroke of serendipity and diligent observation, 3 pioneering researchers, in their desperate quest for a remedy, stumbled upon something truly incredible, something that defied conventional medical understanding. They began administering a most unconventional, indeed rather unappetizing, treatment to their dying patients: raw liver. While the very notion of consuming raw liver might admittedly sound utterly disgusting to contemporary sensibilities, the results were nothing short of miraculous. These moribund individuals, teetering on the precipice of death, astonishingly began to demonstrate signs of recovery. They quite literally rose from their deathbeds, defying all medical prognoses and expectations. The scientific community, utterly stunned by these unprecedented recoveries, duly recognized the groundbreaking significance of this discovery, bestowing upon those 3 pioneering researchers the coveted Nobel Prize in Medicine in the year 1934. Yet, despite this profound recognition, the precise biochemical mechanism underlying the curative power of raw liver remained an enigma. They still did not comprehend the why. It would require another painstaking 14 years of rigorous scientific inquiry before intrepid scientists finally succeeded in isolating the specific magic ingredient meticulously hidden within the complex matrix of liver tissue. This miraculous substance was identified as a complex, brilliantly red molecule characterized by a central cobalt atom at its very core. They christened this vital compound vitamin B12, or scientifically cobalamin. So profound and intricate was the task of elucidating its precise chemical structure that yet another Nobel Prize was subsequently awarded solely for this monumental achievement. Reflect for a moment on the profound implications of this historical arc. One single microscopic molecule, so overwhelmingly critical to the very fabric of human survival and physiological well-being, garnered not one but two distinct Nobel Prizes. But the fundamental question persists. Why? What precisely imbues vitamin B12 with such absolutely critical, life-sustaining importance? The answer lies in its indispensable role as the master electrician of your entire nervous system, a crucial conductor orchestrating the vital processes that literally preserve the life of your nerves. Vitamin B12 performs two absolutely essential functions that are fundamental to the integrity and survival of your neuronal network. Firstly, B12 serves as the primary energetic catalyst for a critically important biochemical process known as methylation. During this complex and intricate metabolic pathway, B12 orchestrates the pivotal transformation of a potentially dangerous and toxic amino acid, aptly named homocysteine, into a fundamentally beneficial and innocuous counterpart, methionine. When this delicate and essential methylation system functions optimally, operating with seamless biochemical efficiency, your body is then capable of manufacturing a crucial compound called S-adenosylmethionine, or SAMe. SAMe, in turn, is absolutely indispensable for the continuous construction, meticulous maintenance, and diligent repair of myelin, that vital protective coating that, as previously discussed, delicately envelops and insulates your precious nerves. In the dire absence of sufficient levels of B12, the dangerous and neurotoxic homocysteine inevitably accumulates to alarming and toxic concentrations. It is akin to an insidious poison systematically flooding your entire nervous system, relentlessly destroying delicate nerve tissue while simultaneously thwarting any intrinsic capacity for repair or regeneration. Secondly, and equally critically, vitamin B12 is absolutely vital for the intricate process of energy production that occurs within the cytoplasm of every single nerve cell. Each one of these specialized cells contains a multitude of microscopic power plants, tiny organelles known as mitochondria. B12, specifically in its biologically active and usable form known as adenosylcobalamin, constitutes the essential metabolic fuel that these cellular powerhouses imperatively require to function with optimal efficiency. Without adequate and readily available B12, these indispensable cellular power plants begin to malfunction and inevitably fail. When these critical mitochondrial structures fail in their energy-producing duties, a highly toxic metabolic byproduct known as methylmalonic acid, MMA, inevitably accumulates within the cells. This noxious acid does not merely disrupt and sabotage the delicate machinery of energy production, it actively and aggressively damages the very structural integrity of the myelin sheath itself, further compromising nerve function. Do you now clearly discern the catastrophic unfolding of events? B12 deficiency does not confine its destructive assault to a singular angle. It mounts a devastating, multi-pronged attack. It simultaneously inhibits the intrinsic repair mechanisms of the protective myelin coating while insidiously poisoning the nerve cells from their very core, from the inside out. Your nerves are thus subjected to a double assault, being both strangled and poisoned simultaneously, a scenario that elucidates precisely why the resulting symptoms are so profoundly severe, why individuals experience such excruciating and unrelenting pain, and why early, decisive intervention is not merely important, but absolutely and unequivocally critical. To procrastinate, to wait too long, is to court the tragic certainty that the damage will transcend the point of no return and become permanently irreversible. Yet, amidst this stark and potentially disheartening narrative, a beacon of hope emerges, piercing through the encroaching darkness of despair. If, as you have carefully considered my descriptions, you find yourself recognizing fragments of your own painful reality within these accounts, then there exists a clear, scientifically validated, and highly achievable path towards comprehensive recovery and restoration of nerve health. health. However, navigating this path successfully demands a strategic approach, a commitment to informed decision-making, because regrettably, even the conventional diagnostic testing processes are, in many instances, inherently designed to fail you, often providing incomplete or misleading information. The foundational first step in this journey of healing is to insist upon and acquire the right diagnostic tests. It is absolutely imperative that you do not merely acquiesce to a standard routine B12 blood test, as this parameter alone is critically insufficient. Many commercial laboratories, adhering to outdated or overly broad reference ranges, consider any B12 level exceeding 200 picograms per milliliter, (pg/ml), to be normal. However, for the purpose of achieving optimal nerve health and preventing subclinical neuropathy, this numerical threshold is dangerously, indeed catastrophically, low. In my clinical practice, I advocate for maintaining B12 levels consistently above 450 to 500 pg/ml, yet even achieving this benchmark, while an improvement, is often insufficient for a comprehensive understanding of cellular B12 status. Therefore, it is absolutely essential that you proactively demand a more sophisticated suite of functional tests, specifically measurements of methylmalonic acid, MMA, and homocysteine levels. When these crucial metabolic markers are found to be elevated in your bloodstream, it constitutes a blazing red alarm signal, an unequivocal indication that your cells are experiencing a profound and desperate starvation for B12, regardless of what a basic blood test might superficially suggest. Even if your routine basic B12 blood test appears to fall within an acceptable range, these more discerning functional tests possess the unique capacity to reveal what is actually transpiring at the cellular level within your body, providing a far more accurate picture than merely assessing what is transiently floating around in your bloodstream. This critical distinction in diagnostic methodology could literally be the defining factor that ultimately saves the integrity and function of your nervous system. The second indispensable step involves meticulously choosing the right form of vitamin B12, a detail where a significant number of individuals inadvertently fall prey to ineffective or even detrimental choices. If you were to venture into almost any conventional pharmacy or health food store, you would invariably encounter a plethora of inexpensive B12 supplements ubiquitously available on the shelves. The vast majority of these widely accessible products contain a synthetic form of B12 known as cyanocobalamin. As its very name implies, this synthetic variant literally contains a cyanide molecule, albeit in a minute quantity. Yes, indeed, cyanide. For your body to effectively utilize cyanocobalamin, it must expend considerable metabolic energy and effort to first meticulously strip off that cyanide molecule, and then subsequently convert the remaining cobalamin into the biologically active forms it can actually employ for cellular function. A substantial portion of the population, particularly those individuals possessing certain genetic variations or polymorphisms, are metabolically ill-equipped to perform this crucial conversion process with sufficient efficiency. Consequently, they are, in essence, squandering their financial resources on supplements that yield little to no discernible therapeutic benefit. The optimal form of B12, the one your body specifically requires and your nervous system directly utilizes to initiate and sustain the repair of damaged myelin, is methylcobalamin. For an even more comprehensive and synergistic approach, seeking out a combination supplement that strategically incorporates both methylcobalamin and adenosylcobalamin is highly advantageous. This dual formulation addresses the B12 deficiency from two critically important angles simultaneously, ensuring effective myelin repair and bolstering intracellular energy production. Hydroxycobalamin represents another excellent and highly bioavailable choice, a form that your body can readily and efficiently convert into its active counterparts. The third pivotal step in this recovery pathway emphasizes that the method of delivery for B12 is absolutely everything. A factor where many individuals unknowingly sabotage their own efforts. If you are contending with underlying absorption problems, and let us be candid, if you are over 60 years of age, consistently taking medications known to interfere with nutrient absorption, or grappling with any form of digestive issue, it is almost a certainty that you indeed have compromised absorption. Then the act of merely swallowing conventional B12 pills is, regrettably, tantamount to, quite literally, throwing your money away. The B12, encased within these orally ingested tablets, will, with frustrating predictability, pass directly through your digestive system without undergoing any meaningful absorption into your bloodstream, rendering the supplement utterly ineffective. What is truly required in such circumstances are sublingual forms of B12. These innovative formulations include specially designed tablets or liquid drops that are intended to dissolve completely and efficiently under your tongue. This ingenious delivery mechanism allows the B12 to bypass the entirety of your digestive system, a common site of absorption impediments, and instead directly enters your bloodstream through the rich network of mucous membranes present in your mouth, ensuring maximum bioavailability. For individuals suffering from severe B12 deficiency or actively battling advanced peripheral neuropathy, intramuscular injections of B12 represent the absolute gold standard of therapeutic intervention. These injections deliver a full 100% of the prescribed therapeutic dose directly into the muscle tissue, from where it is rapidly absorbed and precisely channeled to where your body most urgently requires it. I have personally borne witness to astonishing, dramatic, and truly life-changing improvements in patients within a mere matter of weeks following the initiation of intramuscular injection therapy, with transformations that can only be described as profoundly shocking and deeply gratifying. Step number 4 focuses on precision dosing for the achievement of genuine, measurable results. It is crucial to distinguish between the maintenance dosing necessary for preventing deficiency in healthy individuals and the therapeutic dosing imperatively required to actively combat existing nerve damage. For general prophylactic maintenance, a daily intake of 1,000 micrograms (mcg) of B12 is typically considered adequate to sustain healthy levels. However, if you are actively engaged in the arduous battle against neuropathy, if you are currently experiencing the debilitating symptoms of nerve damage, then you undeniably require therapeutic doses. These therapeutic concentrations typically range anywhere from 1,000 to 5,000 micrograms of methylcobalamin administered daily, sustained for a minimum duration of 3 to 6 months. Robust scientific research has definitively demonstrated that a daily regimen of 1,000 micrograms of methylcobalamin consistently produces significant and objectively measurable benefits in patients afflicted with diabetic neuropathy. Their excruciating pain demonstrably decreases the crucial nerve conduction, velocities improve measurably, and their overall quality of life undergoes a profound and transformative enhancement. The 5th critical step underscores the indispensable role of a robust supporting cast of cofactors, for B12, despite its intrinsic power, does not operate in splendid isolation within the intricate biochemical symphony of the human body. To unleash its full therapeutic potential, B12 necessitates the synergistic presence of specific coactors, vitamin B6, but crucially, only in its biologically active form, known as pyridoxal 5-phosphate, P5P, works hand in glove alongside B12 to facilitate optimal neurological function. Folate, specifically in its metabolically active form as methylfolate, as opposed to the synthetic and often less bioavailable folic acid, is an absolutely essential participant in the vital methylation process. Vitamin B1, particularly when administered in a specialized, fat-soluble form called benfotiamine, has demonstrated remarkable results in its capacity to protect delicate nerve tissue from the damaging effects of chronically elevated blood sugar levels. For individuals contending with diabetes, the inclusion of benfotiamine is therefore of paramount importance. Magnesium, often hailed as your nervous system's natural voltage regulator, plays a pivotal role in calming overactive nerves that are prone to sending spurious and inaccurate pain signals, thereby reducing perceived discomfort. And then there is alpha-lipoic acid, succinctly abbreviated as ALA. This compound stands out as a uniquely powerful antioxidant, distinguished by its dual solubility in both water and fat. This remarkable characteristic means that ALA possesses the extraordinary ability to protect every single component of your nerve cells, both their internal cellular structures and their external membranes, from oxidative damage. Numerous rigorous clinical studies have consistently demonstrated that a daily dosage of 600 milligrams of ALA significantly reduces the intensity of pain, the severity of burning sensations, and the extent of numbness experienced by patients suffering from diabetic neuropathy, offering a tangible improvement in their quality of life. The sixth and final step in this holistic approach emphasizes that food ultimately serves as your foundational cornerstone for long-term health and maintenance. While diligently administered supplements are absolutely essential for correcting an existing B12 deficiency and actively repairing nerve damage, it is a well-balanced, nutrient-dense diet that provides the sustainable, long-term framework for preventing recurrence and supporting overall neurological well-being. The richest and most bioavailable sources of B12 are almost exclusively derived from animal-based products. Organ meats, particularly liver, contain by far the highest concentrations of this vital vitamin. Shellfish, with specific emphasis on clams and mussels, are also incredibly rich dietary sources. Fatty fish, such as wild-caught salmon and sardines, grass-fed beef, pasture-raised eggs, and high-quality dairy products all contribute substantial amounts of B12 to the diet. If you consciously adhere to a plant-based diet, supplementation with B12 is not merely a beneficial option, it is an absolute and unequivocal mandatory requirement for your long-term survival and neurological health. And critically, please do not succumb to the dangerously misleading myth that certain plant-derived sources like spirulina or chlorella provide usable B12. These substances contain B12 analogs, which are compounds structurally similar to B12, but that do not function as true B12 within the human body, and can in fact actively interfere with the absorption of legitimate B12 and even skew blood test results, leading to a false sense of security. Here is the paramount understanding you must internalize. Nerve damage, once it transgresses a certain critical threshold, very often becomes irrevocably permanent. The opportune moment to initiate decisive action is not sometime next month, nor is it judicious to wait until your symptoms inexorably worsen. The time to act is unequivocally right now, today, before you tragically and permanently lose all sensation in your feet, before a catastrophic fall leads to a shattered hip due to impaired balance, or before the insidious progression of neuropathy irrevocably claims your independence and quality of life. That persistent, uncomfortable burning sensation you are currently experiencing is far more than a mere nuisance or a mild discomfort. It is your body's highly sophisticated emergency alarm system operating at its maximum volume, screaming an urgent warning that something is catastrophically amiss deep within your physiological architecture. B12 deficiency, in its widespread but often unrecognized prevalence, represents a silent epidemic, stealthily sweeping through our modern population, undermining health and causing untold suffering. Yet, unlike the formidable challenges posed by cancer, unlike the pervasive threat of heart disease, and in stark contrast to the majority of complex chronic health conditions that plague humanity, this particular condition is profoundly preventable, readily identifiable through targeted testing, testing, and most importantly, completely treatable. Your magnificent nervous system possesses an astonishing, almost miraculous inherent capacity to heal and regenerate itself, provided it is furnished with the precise and appropriate tools it requires. I have personally had the privilege of witnessing patients who, due to the ravages of neuropathy, could barely manage to traverse the short distance across a room, miraculously regain their full mobility and autonomy. I have observed individuals who had not experienced a single night of uninterrupted sleep in years finally attain profound and lasting relief from the relentless, excruciating, burning pain that had held them captive. However, every single one of these individuals, without exception, shared one crucial commonality. They took decisive action before they irrevocably crossed the point of no return, seizing the opportunity for healing while it was still within their grasp. Therefore, if this vital information has served to awaken your awareness, to open your eyes to a previously unseen truth, it is imperative that you embark upon a path of proactive engagement with your health without delay.